Dr. Michaels, I have what I think important and hot and maybe controversial and overlooked topic for you. When people have a gum disease, that could be a very mild one, I guess you guys call it gingivitis, all the way up to a full-blown periodontal disease, and basically what most of you doctors, dentists keep saying is you got to fix it because you're going to lose all your teeth. Now, that's obviously bad. But it does take a bunch of years to do so. And the fact is that even though it is not desirable in terms of, putting metals into the bones and all kinds of stuff, you guys can and do put great implants and other ways, even implant-supported dentures and stuff like that out there, meaning the functionability is pretty good afterwards. It's not like in the old days where George Washington apparently was having a wooden tooth. That must have been awkward. So you're doing a good job, and if a guy doesn't mind to spend the money, so what? Of course you will have a stinky mouth throughout the time. But here's what my point is. If a person can lose his teeth with a periodontal disease, over those years, 1, 2, 5 years, whatever it takes to get to that no return point and teeth need to come out and they're falling out by itself, wouldn't he poison his body like crazy? Wouldn't that infection in the mouth, which is the gateway of the blood vessels, wouldn't it drip into the blood, to the kidney, to the liver? Isn't it true that there is people who have babies, ladies who have babies premature and thus underweight babies? In California, apparently one baby was stillborn because they found gum disease stuff in her placenta. In Japan, somebody researched that it brings the immune system so badly down that actually HIV virus turns into full-blown AIDS much easier because of it. So if those bad things can happen, wouldn't that be much more devastating than losing the teeth, which in itself is obviously no piece of cake? Tell me about it. How far off am I here with this assumption?
You're not off at all. You're actually dead on. We've become very good at replacing teeth and getting people back to function well after they've lost their teeth. But that's not really the issue. This gum disease is insidious and slow process. It's usually painless, and so people can have the presence of pus and infection in their gums and in and around their teeth for literally decades and be relatively unaware of it, or perhaps be aware of it but not care because it doesn't hurt. The fact that it doesn't hurt is irrelevant, and the fact that you're going to lose your teeth someday for them is perhaps frequently irrelevant. But what's important is that there's a bacterial infection that's in your mouth, and you're swallowing that bacteria, and you're swallowing that pus, and you're swallowing all those nasty things all day long. In addition to that, the bacteria gets into the bloodstream through your gums and circulates through your head and through your entire body. And the research is long and deep as to all the numerous and horrible things that this can do. So yes, you're absolutely right. Getting that gum disease treated to get that infection out of your body is the most important thing. Saving your teeth, I think, is probably secondary to that.
That's what I thought. Now, I have even heard that talking to a few surgeons, whether it's a hip operation or appendix type of things, that more and more over the last couple of years, more and more of those surgeons, they will want the patient to go for a clean bill of health from their dentist in terms of gum disease, simply because they say, look, you have a gum disease, if you have a gum disease, that you have weakened your body so badly that if I start cutting around here majorly, and any cut is major, I mean, bodies are not designed to be cut at, then complications can occur, which, well, it just, they can end up deadly. And if surgeons start thinking like that, if things are so bad, what about, again, that crushed immune system, that weakened body? What about the next swine flu, bird flu? Never mind the swine flu, bird flu, just the next flu season. Wouldn't that negatively affect, the body, weaken it, and a person is maybe waking up tired, exhausted, and fatigued, simply because, all the soldiers are fighting this gum disease, and they have no time to fight anything else anymore.
You know, we have excellent techniques nowadays that very simply and inexpensively, without surgery, can completely eliminate gum disease for people.
Wow.
We see patients every day with horrible gum disease, and there are very predictable and efficient and painless procedures that do not include any surgery at all that can completely eliminate someone's gum disease. If you have gum disease, your immune system is suppressed, and obviously you become more susceptible to things like a simple virus, which would give you the cold, whereas otherwise you wouldn't have had it. As far as individuals with prosthetic replacements, like an artificial hip, the real problem is when you have gum disease, the bacterial count in your bloodstream goes way up. And so this bacteria is circulating through your bloodstream everywhere. And what it likes to do, this bacteria likes to settle in areas where there's a fresh cut or where there's an artificial object like a fake hip. And this is what the orthopedic surgeons are particularly concerned about, is the loss of their brand new implant because of the bacterial infection on the implant, which was caused by heightened bacterial concentrations in their bloodstream due to gum disease. So please, if you know of anyone who has gum disease, or if you think you may have gum disease yourself, don't hesitate to see your dentist. It's very simple to treat nowadays.
Right. I mean, one dentist has told me that the gum disease, if it's a relatively full gum disease in the mouth, is as big as a man's hand, all bloody, ugly, and, yellow pus. When we have a little ingrown toenail, we go to the doctor, as we should. If we have a one-time big, something on the skin which doesn't go away after a week, 2, 3, we usually go to the doctor, as we should. But we have a whole handful of that stuff in our mouth, and we seem to be reluctant to go. It's quite funny.
Yeah.
Well, I appreciate your, people should really definitely take that to heart. I really think so, because, I look at it as an everyday lifestyle. I mean, if you predispose yourself to an everyday cold and all those type of stuff, the worst doesn't have to happen. You don't have to die from it as such. At the same token, I think you dentists and other doctors constantly see people who go very old, miraculously also always having a good oral health. Is that true? That correlation?
That's absolutely correct, yeah. Back in the old days, 20 years ago when I first started practicing, I would say 90+% of the patients that we saw had gum disease of some degree or another. And now it's down to 10% or less. So we've made great strides in dentistry. And the biggest factor has, in fact, been the patient's interest in taking care of themselves. The population as a whole has heightened their interest in health, and they want to be healthy. And with education has caused them to understand the presence of gum disease and its harmful effects. So we've made great progress, and there's still ways to go, of course, but we've made great strides.
Thank you very much, Dr. Michael.
Thank you.